for some reason.
Mm-hmm.
There we go. Now we look like we're live.
All right, great. Yeah, it looks like it's going live. It's going to take it a second to connect on our other accounts. And yeah, perfect. Well, we'll kick this off here just really shortly. Give this about 30 seconds to get some folks jumping on here once they're ready. And yeah, we'll kick this off. And today I wanted to talk about a subject that's near and dear to our hearts, and one that doesn't always get enough attention as it really deserves. And that is the issue of the psychology and the mental health wellness of going through IVF or going through fertility treatment. And the reason that we're talking about this subject is that Dr. Amos and I were at a fantastic scientific conference in our field, the Pacific Coast Reproductive Society in Indian Wells, California last week, where experts from around the country come together to talk about kind of what's new and great in our world, but also a reminder of the really, really important parts of IVF. And there were some excellent keynote speakers talking about the importance of mental health as it relates to going through fertility treatment. And a couple of the talks really, really resonated with me. And the talks really were around the impact that going through IVF has on an individual's mental health as they go through the process. And there were some numbers that really stood out to me. I have to say, I learned a lot from this. I mean, one speaker was sharing some numbers around the risk of, individuals having very depressive thoughts, even to the extent of suicidal thoughts in rare cases, after they go through a cycle of fertility treatment, IVF, that doesn't work. And so there were many opinions in the room, but I think one opinion that was shared by almost everybody is that mental health wellness is really, really important as we go through fertility treatments and IVF. And I think one thing that we wanted to share today are kind of differing perspectives, maybe similar perspectives about, what our patients can do as they go through the process of IVF to manage their mental health wellness. And I'm not saying that it's going to be a breeze or there's kind of some silver bullet here, but there are some different strategies that we've come across over the years, just with our experience, seeing a lot of things that work, things that don't work. And I think there are different approaches that work for different people. There's not a one size fits all for managing mental wellness and anxiety as you go through IVF. And so maybe a kind of a fun way to do it today, I don't know what you think, Dr. Amos, like we could just talk about some of our favorite things that we've seen that people have done for managing mental health and anxiety as they go through IVF, and what we think has worked best. Just some of our opinions around some of those things.
Yeah. I mean, like you said, it was a big portion of the conference. And, we were just talking before we got on. I was saying how stress is one of those weird things because it's something that we know can affect the patient more than it even affects the cycle. But the thing is that if you're stressed out so much that you can't continue moving with the cycle, or that, you're not even able to enjoy the cycle, it becomes very stressful as well. And it's just a cycle. One of the funny things I think that is kind of interesting is, so one of the doctors I used to work with, and you know her as well, Dr. Allison Rogers, so she's a reproductive doctor. And I remember when she had to go through fertility stuff, one day she came to me and she's like, could it be I'm too stressed? And you have to understand, as a fertility doctor, we know that really stress shouldn't make you not get pregnant. And that's because we have, lots of data from even other countries. I mean, you look at countries that have war going on and people still get pregnant. So we know stress is to be very, very severe to stop someone from being able to get pregnant. But here it is, someone who's not just educated, not just knows REI, but understands it to a T, and even she was worrying about it. So this is someone who already knows it won't cause a problem and was worried about it. And so I think it is something that, everyone's going to have, even to the point of people who do this for a living still have it. And when she, she was worried about it, she even said, "It goes, am I going crazy? Like, I know it's not this," but she goes, "I'm just worried. Could it be that?" And she goes, and I tell all my patients it can't be that, but stress is a big thing, and everyone has it. I think you hit the nail on the head a little bit about how everyone deals with it differently, but I think the source of it always comes from the same thing. And what usually causes stress is going to be things of, not knowing something. So like, fear of going into something that you're not expecting. And so you don't know what to expect, but also expectations. One of the things is that we have expectations, and these expectations, when they're not met, is what causes a lot of stress. So in marriages, you expect the marriage to be, just like it is on, the Disney Channel, and it's not, and it causes stress. You expect your first transfer went fine, the second one doesn't. Again, expectations. And so I think some of the things when we talk about is I'm going to give some of my own personal experiences that I've done to reduce stress for my wife and I when we went through IVF, and some of the things I do personally to help reduce stress. But in the end, as you pointed out, everybody's different, and the way people handle the stress, what causes the stress, is going to be slightly different for everyone. But usually, it comes from, like I said, that either expectations that you've set that aren't real, or the other thing is going to something unknown. So the fear of, like, I don't understand what's happening, what's going on, is this going to ruin everything? And then you start having that cycle of, is this going to cause problems? I kind of think of it like, it sounds kind of funny, but when men, like, can't get erections, this is a very common thing that men, have a problem with erection. And then it becomes a psychological thing. And they start thinking about, oh my God, am I going to have problems again this time? And then now they can't, because they've created this thing. And the same thing can happen with stress. At one point, you're going, can stress cause a problem? Oh my God, I can't have stress. That causes you more stress. And now it just becomes a cycle. And so today I want to focus on how to break that cycle, what things I've done to help with it. And I'm hoping you have some great things to add to it too.
Yeah, no, I totally agree with that. I think one of the other, buckets that we'll talk about is this idea that when you go through fertility treatment, you lose control. You lose control over a lot of things. And I think it goes along and it falls under the umbrella of those things that you talked about, but it's something that we hear a lot from our patients, and something that I think, many people who are of a certain personality type, like historically we call it like a type A personality. When you give up this much control over something, it can feel very stressful. And I think that amount of stress builds up. IVF takes a lot of time, a lot of visits, a lot of appointments, a lot of blood draws. And these are many things that are, things that inevitably kind of feel like they're happening to you, as opposed to you being really, really in the driver's seat. And some of it is about perspective. Some of it is also, of course, about, to an extent, letting go a little bit of that control, which can be a very anxiety provoking part of this. But I thought one of the things that, I kind of start with in terms of strategies for managing anxiety during IVF is simply knowing what it is that you're getting into. So in other words, being well informed. It's amazing how making sure that you know kind of what the timeline approximately looks like, understanding roughly the number of appointments that you'll have for something, understanding the chances of success as we go through a round of IVF, given your age, given your parameters, how some of these things can actually answer a lot of can give you a lot of answers and decrease the burden of the unknown. And sometimes the answers are not necessarily what you want to hear, but they are helpful in setting expectations, like you were talking about, Dr. Amos. And so I've had a lot of couples, patients over the years tell me, it was really helpful that we had a really good sense of where we were going with things, because then we weren't, immediately taken for a wild roller coaster ride, and so probably the best strategy there, if I had to throw one out in terms of that group, would be ask the questions that you want answered. Ask the questions of what matters to you. How long does the process take? how many, days of injections will I be getting on average, roughly? Or maybe that doesn't matter to you. Maybe what matters to you more is, what are my chances of success? Just flat out, that kind of a thing. So ask the questions that you want answered, I think is one way to manage that. But that's the first one I'll throw out there. What about you?
Yeah, I mean, I concur completely. I literally did one of my podcasts. One of the things I always constantly talk about is ask the questions. Even your very first visit to the doctor, the most important thing is to get your questions answered, because you're coming in with all that stress of what if it's this, what if it's that, and you're right. Those questions getting answered. The hard part is you don't know everything to ask, right? So some things come along and you don't know. Middle of the night, something happens and you think, "Oh my god, I ruined my IVF cycle, or I ruined my chances." And so I think chiming on where you were saying is, there's educational things out there. I mean, obviously, this is a show we do to try to educate people. We want to make it live so people can ask questions. I do a podcast, which again, I talk about things like I even go over one on how important, like the timing on the medications. If you miss your goal up by an hour, are you going to really affect your cycle? And there's even written stuff out there. And so I think, as you were saying, educating yourself does help. I think another thing is having like a social network as well. One of the things that we decided to do at our clinic, and again, this is just our clinic, other places might do different. We created a Facebook group just for our patients, and the purpose was we wanted our patients to be able to talk to each other, be able to, they know our process, so people can ask questions and probably get answers that are going to be very similar to the route they went. And I think there are other groups out there. Now, I know for some people, those other groups can be a little bit scary because they feel like they're being judged and stuff like that. But they're still good even as a passive participant, just listening it in and watching what happens. You can sit there and go, "Oh wow, that lady had the same problem I had," and it can help. And so I think having a good social network, whether it's through Facebook, through whatever network that is, I think that's always helpful. And obviously, we're going to talk about having family around or friends and stuff that you can talk to. But that's one of the areas. Before we go into like the next thing, I mean, I can tell you, my wife and I, we knew we would be stressed about this stuff. And so one of the things we did was at every transfer, we always went and did something afterwards. So for example, if we did a transfer, we would then go to like Chicago. And we just didn't want to think about it. Now, for everyone's a little bit different, but just that 10-day wait is so just hard. You start thinking not even the worst. It's actually, you think the best. I always tell people, as soon as you do that transfer, you start thinking about having a kid and stuff. And we just didn't want to think about it. And we just thought out of sight, out of mind. And so we went and did a little mini vacation. We went to Chicago for those 10 days and enjoyed it, and then came back, got the pregnancy test, and got good news. And so I think, for some people, that's something they need to do. They need to, just not think about it. There are other people, like you made the point, that everyone's different. Some people might need to test every day. And for them, that's the thing that helps them with stress. Whereas another person, it may cause them more stress checking every day. And so it's different for every person. Just like at our clinic, we sometimes draw bloods early, but I'll ask the patient, do you want to know the results that early? That might cause them too much stress. And so I think one of the points you made is everyone's different, and you got to find the thing that kind of, causes your stress and then address in that way.
Yeah, no, absolutely. And I think there are kind of there are different periods in the IVF process that are stressful, and I think this is such a key part. I would love to hear from some of the folks out there, kind of what they thought were the most stressful parts of their process, because
Yeah.
I've heard from some people it was before my first appointment that was the most stressful. I've heard from other people it was the day I started my injections because I didn't know what I was doing. I heard from other people that it was, once I went through the process and the eggs were retrieved, then it was really out of my control because, whatever was happening in the lab, I had no control over it, and the numbers were dwindling down as they should, from egg to fertilized egg to embryo. But I think that the phase of the process in which you're going through really matters, and I think we all have different needs during those times. And I find that, like you were talking about, you and your wife when you were after the embryo transfer. That was a really stressful phase. And I think other people have a really stressful phase as they're waiting for like the results of the PGT testing. Um, and it's interesting because at different points in this whole process, there are more touch points with our system. And so one of the pieces that I've always thought was really interesting that I've heard from our patients is that it's actually after they're pregnant and they graduate from our clinics and they say that was a really stressful time because you guys were kind of holding my hand the whole time. I was checking my progesterone levels. You were checking this. I was getting an ultrasound every other week. And then all of a sudden, I was with my OBGYN, who was wonderful, but they said they didn't need to see me for 4 weeks. And that was a very anxiety provoking time. And so some people have done some interesting things. I've had a few patients in that exact bucket who said a support group was really helpful. Having other couples who had gone through IVF who were roughly in the same period of time, just talking to each other, exchanging notes, and they said that was extremely helpful. Other people have also tried things like talking to a mental health expert, like a therapist. And I think there's an enormous amount of benefit in that if you're the type of person who gets benefit from that. And so you really kind of don't know until you try, I think. And I think that's a really, really wonderful place. And it's a very empowering place to be to say, hey, I have a mental health expert who I talk with, who helps me through this process, who coaches me on certain things. And that is a part of my bigger team as I go through the infertility or fertility experience. Yeah, I guess I'll turn it back over to you, Dr. Amos.
Yeah. So I think, the thing that we wanted to talk about, and I think with, kind of talking to everyone out there is stress is normal. That's an important part to understand. And it's a very stressful situation too. I mean, no one should think it is. I mean, you're wanting to have a kid. You're not sure if it's going to work. You're doing things you've never been taught before in your life. You're now all of a sudden became a nurse because now you're giving yourself injections. Um, then, if you are fortunate enough to get to the point of getting to, let's say, treatment, especially IVF, and you get eggs, now you have to fear every day as the attrition of those eggs go to, embryos all the way down to blastocysts and then to being tested. That's stressful. Then on top of that, then you get pregnant, and now you almost believe like it can't be true. I can tell you as an infertility patient, one of the things that you always feel is you feel like this can't be true. I can't be this lucky that something's gonna go wrong. I'm gonna have a miscarriage. And that's a normal feeling. And it's scary. And especially if you've had a miscarriage. And I think one of the questions we have here that we'll talk about here in a minute is once you've had a miscarriage, now every pregnancy after that, you're always worried about that. You can't even enjoy your pregnancy. And that's the difference. I don't know what it's like to get pregnant easy, but I'm assuming they probably don't stress about those things. But I've never experienced that. My wife and I have only experienced having to spend thousands and thousands of dollars to have a kid, or you have to do something invasive. But I imagine most people, when they get pregnant, don't even think twice about it, and then they're just like, oh, yeah, it can happen. And whereas when you work so hard to get to this point, I mean, just the fear. And then I've never been on these hormones, but just being on those hormones alone, I mean, it's kind of, I think we haven't even touched the surface. We're really like how tough this is on a human being to go through this. And then take a step back. It only affects, let's say 1 out of 7. Now they're saying, 1 out of 6 people, but realistically, I mean, not everyone goes through the same amount, right? So when they say 1 out of 7 people, it can be a little bit of infertility, right? But there's some who have very severe infertility. And so it's hard to talk to people about because all your other friends are getting pregnant. It can almost be, it's difficult to talk about. So I think one of the neat things here when we talk about all these different things and what we learned at the conference is that we're realizing mental health is really important in this, and each person is different. Like I keep going back to, you have to find what works for you. But I'm one of a big fan of counselors. I tell people all the time, like, if they're having a hard time, like, get a counselor involved, talk to them. So anyways, I'll let you keep going. But like I said, it's funny when we talk about it, it just reminds me of some of the stress I've had, like some of the
Yeah.
stuff that we had to think about, like, oh my God, when our daughters almost got born at, before viability, like the thought of like, oh, yep, here it is. We weren't
Yep.
meant to have kids. Like this, something bad's gonna happen.
Yep. It's really remarkable because I think, our field is in some ways narrow fertility, right? It's just a small part of medicine, but it touches on so many different parts of one's well-being. And I I I always worry that mental health and the kind of the importance of mental health has been neglected in some small part. I mean, it hasn't been completely neglected, but it is something that the traditional, fertility infrastructure practice isn't super well designed to take care of people's mental health as they go through this process. But the interesting thing is this: in the current world that we live in, IVF has become really good, and fertility treatments have become really good. And most people, if they have the resources, if they can stay with it long enough, they will usually end up with the outcome that they want, which is a baby. The single largest reason for dropout is mental health. People say that I've had enough. This is so stressful for me. Now, I don't want to underplay the fact that stress can be many components, right? There can be a financial stressor, there can be a physical stressor. All of these play together, and people eventually say, "I've had enough. Enough is enough, and I'm going to stop." And I think that it's it's something that I wish we paid more and more attention to, and that's part of the reason we're doing this talk today, is kind of how can we get better. And we'd love to hear, from folks out there how they think fertility clinics could do a better job with this. One thing that I've found that has also been very nice in the past is collaboration. So fertility clinics collaborate with other independent providers out there, either mental health providers, or in many cases, acupuncture. And so, acupuncturists offer a great service, and many of my patients have gone to see an acupuncturist. And what I tend to hear from them is more about the wellness experience that they have, meaning they come back and they say, every time I do acupuncture, I just feel much better afterwards. I feel decompressed. And, I always say it's very difficult to study Eastern medicine through a Western lens. So, Western lens being kind of the type of medicine that we do, Eastern, or, acupuncture medicine functions in a little bit of a different realm, a different space. And so, I really appreciate that, we can kind of marry the two. And I think that a lot of our patients who are, open to something like acupuncture get a ton of benefit from it. Now, obviously, if you're like deathly afraid of needles, probably not the place you want to start. But have had, tremendous like experiences with people coming back and just saying, this really worked for me. I feel a lot better. Having another person also on your team, I really think there is benefit to that, to having another person that you can bounce some ideas off of, talk to them about your experience going through IVF, and they're outside of the four walls of your fertility clinic. I encourage that. I think it's wonderful. Um, but that's another one that's high on my list of things that people have done that's really wonderful.
There's some cultures too that things are even more stressful for, right? So I have some patients from certain cultures where, not getting pregnant could be a reason they could lose their marriage. I've I've had patients actually ask me to lie to their partner,
Mhm.
that, if they use donor eggs, that it's still their eggs and that they'll divorce them if they're not. I mean, again, there's so many areas for stress in this whole situation. I mean, I even go back to the expectation part, right? What's our expectation? You meet someone, you fall in love, and when you want to have a kid, you just go and have a kid. Never do you think that you're going to have to go and see someone. Then you go and see someone, then you look at the bill and go, "Oh my goodness," because now not many insurance are coming. Now you have the financial stress. And then we talked about the when you go online, and I think this is something really important for people. When you read things online, keep in mind those are the usually odd stories, meaning No one goes online and says like, hey, I went and did IVF, everything went perfect, I had a kid. Like usually that's going to be in like your groups and stuff like that. But when you hear the stories are usually the bad scenarios. And so it's easy sometimes to get really scared. I can't tell you how many people I have come into the office and say, oh my God, I'm so worried this one woman had 40 eggs and then she only got one embryo from it. And it's true, that does happen. But the problem is now people have that fear. And this is where like sometimes educating yourself can be a little bit too much, is depend on the source. And that's why I say definitely listen to podcasts, listen to things like we do, because someone will tell you, well, yes, that's true. Someone who made 40 eggs might only have one, but there's a reason why. That person probably had PCOS, probably had, insulin resistance and caused issues. And that someone who makes 20 eggs, that's not going to happen to, because they don't have that same milieu from the metabolism to create that problem. And so again, that's another area of stress of misinformation, right?
Right.
One of the patients on here said, the trigger shot was a big scare for them. And I would say all the shots are, right? I mean, I go back to that point. None of you are medical people all the time, right? Or even if you are, I mean, I get nurses who get scared of stuff like they made that mistake. Sometimes you read things that will tell you that the timing has to be exact. Patients go, oh my God, I was supposed to take the shot at 8 p.m. For my goal up. I took it at 8:10. Did I ruin everything? You're like, no, it didn't hurt anything. And so that's where those questions, you should never be afraid to keep asking questions. Never be afraid to, talk to your doctor. Again, that's what we're here. That's what you're seeing them for their expertise. And then another patient brought up a question about, once you're pregnant, and this is where we're talking about. And so I definitely go over all these different clinical situations, but I think the question is how do you do stress management, right? I mean, what's the answer? And so one of the things I tell a lot of people is to do what you do that's fun. Even people who are like depressed, one of the things that helps them is forcing themselves to do the things they enjoy. So for example, like I have patients who might work out a lot. And it's true. I don't want someone doing some crazy like P94XP, exercise. I don't even know if that exists or anything, but it's something like that. And so, and I said, no, I want you doing that. It's too much on you. But on the same token, I don't want them to be, on the couch doing nothing, because for them, that's an outlet. For them, that is how they reduce their stress. So there's a compromise, right? This is where you talk to your doctor and say, okay, what can I do? Can I walk? Can I go on elliptical? And that's going to let them then still have a little bit control, back to that part, you're not taking them completely out of their environment. There are some things that are absolutely a no. Like I always say, no crack cocaine. You can't do it. It's bad. But if you're like, but can I have some Chick-fil-A? Sure. And so there's substitutes. So my point is, and being humorous, is that you got to do the things you like. And as long as that thing won't affect things, make sure you keep doing it. And also make sure that you think the things you're not supposed to do are not true. Like I said, the misinformation where someone tells you, oh, you're not allowed to drive in a car after a transfer, you can't stand up or you can't go on a plane. People have asked these questions before. And I can assure you they're available somewhere, whether it's podcasts, whether it's Facebook groups. You got to go get that information. Like Dr. Salem said, being knowledgeable then will help you not be stressed about that.
Right. I got a great comment over here on our Instagram feed that one of the things was involving the male partner more. One idea that a listener kind of put in, and they said, it's really important for managing stress as you go through IVF to involve the partner more. And I think that's a phenomenal point. Very oftentimes in the traditional context of fertility, the male partner is kind of like, plays second fiddle, or really kind of is off on the side, not doing much. And I think the reality is that there's an enormous amount that they can do to try before the cycle to optimize things. And that can really, be something that the couple works on together. Healthy lifestyle things, exercise, good sleep quality. Many times those things are immensely easier if you do them together. And by the way, they help. What helps the sperm helps the egg. So this is a great way to include them early on in the process. The other part, though, that's really important, and I just love this comment that this person made, is involve them in the process. And this isn't always easy or intuitive, but I think many male partners, once they get involved in the process and they know that there are some things that they need to be responsible for, they need to help, the fact that you're kind of working at this as a team becomes very, very helpful. And I always tell my patients, I'm like, I would love to see both of you at the consult. I get it. Sometimes you can't both be there. Somebody has to be at work. Somebody has to be doing this. But I just expressed to them, I would personally love to see both of you, because I want to put the information in both your hands, so you can go through it together. You can help each other. One of you is going to forget something, the other one might remember it, or maybe there is something around taking the medications. If we teach both of you, you're more likely to get it right. You're less likely that one person will make that mistake. And I do think on the flip side of that coin, if only one person is taking it all on their shoulders, and that's almost always the woman, if she's taking it all on her shoulders, as she goes through the IVF cycle, kind of feeling like is going through it alone, that is undoubtedly more stressful. So, I really encourage everybody out there, to the extent reasonable, possible, etc., involve your partners. If you have a partner that's going through this, involve them, encourage them to come to the visits, ask what they can do, have them be engaged, have them have a part in the process. And that ultimately helps as you go down the process 3, 4, 5, 6 months later.
Yeah. And we really want to encourage people. I mean, please, call in, send us questions. Keep in mind, we're telling you what we think is important, right? But we're the doctors, right? We see it from a completely different perspective. I mean, when I was listening to YL just a second ago, sorry, Dr. Salem, just a second ago, was saying how, involve the men. Part of my mind was like, I'm like, man, sometimes it's hard to get the men involved. Like, it's almost like there's jokes about I'm just a sperm donor, and I think it is important to involve them, like you said. And I think this is where you talk to your doctor, right? And just say like, hey, how can I involve them more? I think women too tend to, for them, want them to be involved, right? And so sometimes guys don't know what to do. How can I help? What can I do? And so talk to your partner. Again, that will help reduce stress. Let them know what they can do. I've seen some amazing partners. When you were talking, it reminded me of something. And I think part of what makes, I think all clinics are good. All clinics want to help people. But I think what makes some better than others, and doctors better than others, is to think about these things, right? And so when you were talking about like, involving the partner stuff, it's when I have someone that I'm doing IVF, one of the first things I notice is that they're by themselves, and one day the partner's there because they can't be there every day. I'll actually say on that day, go, hey, how about we go over the instructions today on how to do the trigger shot, since you're both here, get 2 years, and we can always teach it again when it's time to trigger, but it's doing those type of things. And so you can be an advocate for yourself as a patient, say, hey, I know we're not triggering yet. You guys are going to teach me, but if you're at a clinic that's going to teach it later and you have your partner there, have them teach you it then. And so, again, as a patient, you can be an advocate for yourself. The same thing is like with OB scans. So I have patients who are very stressed out. One of the first things I ever do when I do an OB scan, and I'll admit I don't do a lot of them anymore because I'm a little bit busier, but when I do them, the first thing I tell them, the minute I put that probe in, I don't even look at anything else. I tell them there's a heartbeat. I let them know right away there's a heartbeat, because I know that's all they care about, to help reduce that stress. Because before that, it's just built up. Oh my God, is there going to be a heartbeat there? Is there not? So I just start with that, and you could just see on them, they're like, and then everything else is just measurements and stuff.
Yeah.
And so, the same thing with, I have patients who have very severe, recurrent miscarriages and stuff like that, or have bleeds. And so one of the things I, will do is say, why don't we come back every week? I'll bring someone back twice in the same week if I need to help the stress. Now, again, not every doctor might have been through this and doesn't understand maybe the stress of it, but there's nothing wrong with that. Talk to your doctor and say, hey, I'm really freaked out. I am so scared. Can I please come in every 4 days? Can I please come in every week? And that's reasonable to ask for, because that's what you need. Some people might not want that. They're like, I don't want to look too soon. And so it's back to that point you were saying, is that yes, there are going to be some doctors who are going to do this directly, but sometimes you have to be an advocate for yourself. Sometimes you're going to have husbands who are going to just want to be involved. Sometimes you're going to have to be an advocate for yourself and ask them to be involved. And I'm sure they will be, because they love you.
Yeah. Well, I got another comment here about, things that help and things that were very supportive. And it's a great comment, and it's a shout out to all our nurses, and our medical assistants who are talking with patients in the little moments, in everything, between things, taking the medications, whether it's, via a message, or whether it's a phone call, or whether it's in person. There are, they are incredible resources, the nurses, and they, I can tell you with 100% confidence that every single nurse who I've ever worked with in this space wanted to be there, and wants to be there really badly to help other people through this process. And it means a lot to them. And so while they are excellent at the medicine and the science of it all, they're incredibly empathetic people, and very, they're very willing and very open to hearing you out when there is a tough moment. And I think we can give credit to many nurses for, being the reason that couples were able to make it through an IVF cycle when things were really difficult. And so I really wanted to just have that shout out there to all our nurses who play a really big role in the mental health, wellness and anxiety as couples are going through this.
Yeah, and kind of a little tangent to that, I think it's a important part I want to stress, and that is, we are so worried about everything going, wrong or right, that we look at everything, every little detail. I was a patient once, right? Someone says your name slightly wrong, and sometimes you go, "Oh my God, do they know who I am?" And that creates stress. And what I would tell you as a patient is that people are human. People will make mistakes. And one of the things that will scare you is, because it could happen, happens at our clinic too. We're not perfect. Not big mistakes. We're talking little mistakes. But then you start having the wheels go in your head, and you start thinking, well, wow, if they didn't put a paperclip on this, they didn't put this on this, and they didn't do that, now I have the wrong sperm, and now I have the wrong sperm. And it's really easy to go down that path. And because of that fear. And so one thing I'd say as a patient that I had to do is I had to remember, like, when I was going through this, I kind of watched a lot of stuff myself. So I had like all my own numbers and things like that, and sometimes I'd see a doctor and maybe they forgot something. And it's important to remember that that doesn't mean that you're not going to get pregnant. So my point I'm just trying to say is, I'm not saying that it's okay. No, it should be perfect, right? We want it to be perfect, and everyone tries, but in reality, no one's perfect. And so because of that, it can cause a lot of stress. And so what I'm basically saying is not an excuse for clinics not being perfect, because it's going to happen, but just understand that truly, though, the chances are things are still going fine. Now, obviously, if it's something really big, then that's a big deal. But I'm talking about the little things. It's very easy to start getting scared, and I just want to reassure people that just because maybe someone at the medical assistant doing something doesn't mean your doctor's doing something wrong or the lab's doing something wrong. They are completely independent things, and if those are things you're worried about, talk to them. Call the clinic up and say, "Hey, I'm a little bit nervous. Someone called me the wrong name today, or this, and now I'm worried. Like, do you really know me?" And sometimes if you get the information behind it, you may go, "Oh, you know what? I didn't realize that she was new or something like that, or she didn't understand that." And it will at least reassure you, make you feel comfortable versus that stress. And that's where we keep going back to all these things: is ask, talk, be an advocate for yourself. Don't ever assume, because that will just make you more nervous. Just ask. And like I said, you probably will feel a lot more comforting, because there's been times when people thought there were mistakes made and they weren't. And they were freaking out. I go, no, that was supposed to happen. And they're like, well, why would that happen? I'm like, oh, I changed it. But because no one told them, they thought it was a mistake. And so, you can see how that's why I say always ask questions. There are no dumb questions in this. So. Anything to add to that?
No, I think that's great. I think we have somebody who is calling in and wants to jump on and ask some questions. Yeah, so we can go there.
Perfect. Okay, so we're going to bring Crystal to stage here. Hey, Crystal.
Hello, you guys. Hi. I have my headphones in, so good. I was wanting to talk because I know you guys are talking about stress and all that. I've been with Dr. Amos for like 10 years, and I've been trying for 10 years. And I tell like all my friends, my family, and like my coworkers and all that. And they're always like, they tell me, they're like, how the hell, excuse my language, I'm sorry, how the heck do you guys do that? And like how you're such a trooper for going through that long. And I'm like, well, when you're tempted and you want something, you're gonna keep going and you're just gonna do it. And it just makes me even like even when I'm at home and doing stuff and like watching TV or out doing errands and all that. It just yes, my mind is always on it, but then it's like I always think of like the positive and all that. So I know that's probably like off the subject, but
I don't know. Crystal, do you mind sharing with us? I mean, how would 10 years is a long time, and obviously, people know how difficult of a case you have. It's extremely difficult. How's it affected? Like, just like how do you manage how it affects like your relationship, and what are some of the things you've done to help yourself get through some of these stresses? What has he done to help us to get through some of these stresses?
so my husband is like a gamer, and he's honestly he kind of lets me call the shots. He lets me do everything. But he supports me and everything. And like at first, when we first started with Dr. Amos, he did not want to go through with it because of the financial and the stress. And then he knew like of my whole history and all that. And but no, he lets me call the shots. And honestly, for me, because of how my personality is and how I'm so upbeat and so like just just so energetic and everything, it's just kind of like I don't even I hurt like when I show emotion, and that's rare for me because I'm usually like really happy, go lucky, just out crazy, enjoying the world type of person. So it's yeah.
Well, you heard us talk about some certain things. We talked about like, people want to work out. We talked about talking. I mean, you ask me questions all the time, right? There's times where you ask to do things that like, hey, that's not an unreasonable thing. What do you think about some of the things we said? I mean, is there any truth to some of the stuff we're saying? Have those things helped you? Anything you want to add?
Okay, don't get mad at me. But one, I don't believe in working out. I don't believe in diet. I don't believe in all these voodoos. I don't believe in anything. I just believe in focusing on yourself and just thinking positive. That's the main thing for me. So I don't believe in like any of the stuff that people say. And if people do say it, I just blow it in one ear and out the other. So, I mean, like with you guys, like I take it to heart and everything, but I mean, like within the groups or like my family and friends or anything like that. So,
Well, everyone's different and everyone needs different things. Absolutely. And some people, exercise is important to them. Like I said, for some people, it's actually extremely important. I've had people not go through because they said, I don't want to stop my exercise. You don't have to stop. Any questions you have for us and for specifically about this at all?
nope. Just wanted to come on here and just to talk about that and say hi and just show you
Well,
I'm doing great and can't wait to get the new journey started. So,
Well, we really appreciate you coming and sharing this. And like I said, it always helps us to be able to hear a different view. Like I said, and I think you pointed out you basically said exactly what we said is every person's different, right? And you said I don't believe in this stuff. I don't do those things. but there are other people it's important to, right? And so it sounds like with you, you have a very smart husband. Unless you make the shots, that's a very smart husband. And it sounds like you have a method that works for you, which is, kind of you kind of like what's the word I'm looking for? Like just let things happen, and that you just go with the flow. It sounds like so.
Yes, exactly. And then if I have a bad appointment or something, yes, I get all emotional, but then it's like give me like a nap or like a few hours and I'm like talk to Peachy Keen again. I'm like I forgot it even happened. So
And
it's
you ask
I just
questions.
kind of
You always ask me questions too. That's how I feel like you deal with a lot of it. Is you ask questions and ask for things, so which is good. I think that's a good way to deal with it.
Yeah, that's really wonderful, Crystal, and it's impressive that you have that positivity, and it's such a great trait as one goes through something as difficult as this, where it's you know for a lot of people it feels hard to maintain the positivity. So I mean, what have you done to maintain positivity, from month to month? What it sounds like you're just generally a positive person, but what have you done
yeah.
as you go through your treatments over the course of a few months to maintain that positivity?
I have a very good support system. Like Dr. Amos is part of it. I have a celebrity friend who's rooting me on. I listen to music. I absolutely love music. So it's just I have like my own little routine thing, and I if I need anything, definitely I don't waste time. I ask questions. I don't hold back.
You know,
That's great. That's great. I think there's some like really, great things to take away there for everybody from that, support systems, asking the questions to, alleviate the unknown so that you don't have that. And then sometimes what it sounds like you're also saying is like moving forward. You do something, whatever happens, and you move forward and you're like, okay, let's focus on the future. And these are wonderful traits, and some of these methods are probably things that some people could take and use themselves.
Exactly. That's what I tell everyone too. So they always come to me and be like, "Oh, I've blah 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 blah," and I'm like, "Well, you just gotta look on the positive side, or do what I do, or I just positive. I guess that's all I do." So
well, thanks so much, Crystal. Like I said, we really appreciate
yeah,
your time. And we didn't have a lot of people afraid to come on today, but again, we really want to encourage people. Come on. Again, you don't have to show your face. You don't even have to put your name down. You can put down your name as Chachi or something like that. You put whatever you want. But again, hearing from people definitely helps us have different things to talk about. So thanks again, Crystal.
you're welcome. Thank you, guys.
Take care. Here's one that has also come up, and I thought we'd put it out there because it's something that we often get phone calls about in the middle of the night, which is early pregnancy bleeding. So, and this is something that it can be very anxiety provoking early in pregnancy, and especially when the pregnancy's been so hard to come by, and that can really kind of you know cause a huge rush of emotions, and then all the kind of I think a lot of people start thinking of the worst possible thing that could happen. And it's a phone call I've had with patients many a times at 2, 3 o'clock in the morning. And yeah, what's your perspective on that? I mean, I think this is such a difficult thing to go through for our patients.
I mean, the whole thing's stressful. I mean, I'm telling you, like, I don't think I thought I was not going to be stressed once the kids were born. I'm like, okay, finally, now they're born, right? I made it to that point. I was still stressed out. I'm like, something's going to happen to them. I think we're probably the fertility parents probably are the biggest helicopter parents that probably are around, because you're like, first of all, it took so much to get there. You never know what's going to happen again. And you're like, that thing cost me a lot of money. I want to make sure I, take care of that thing even better than most. So, um, every part's stressful. I think if there's anything I can tell someone, the best way to relieve stress when having bleeding is don't go to the ER. I mean, I'm not saying there aren't times you need to, but one of the most I would say the most stressful things is going to the ER with like some spotting. They will put you in a corner for 6 hours. They will have someone who hasn't done a gynecological exam in like 2 years. They will, they're like, we think it's this, I don't know. And it can almost be more stressful than just what I'd say is try to talk to your doctor. And then they can at least, talk you off from the edge. And then if you can, by the next day, see them. There are times where I tell people, I said, listen, if you need to know tonight, you go to the ER. But I can just assure people, like almost anyone I've ever had go to the ER for bleeding, it has been more stressed than it was beneficial. And I've even had them say things that aren't true, like we're going to tell them the heartbeat's not there. And then the next day they come in, because I never trust the ER. Not that the ERs aren't good. They're great at saving people's lives. But unfortunately, I've had people, been told something's not good, and then they come in and it's fine. Again, talk to your doctor. And if your doctor's not available, then like I said, if you can hang out or call a friend who knows something, or, see if Dr. Amos is up online on Facebook, send a message there or something. So.
Yeah. Yeah. I mean, it is such a stressful thing. I mean, I remember our own story with that, and many of my own patients, having that call, and it's the kind of thing that I think also because it's unexpected to a lot of patients. I mean, it's not unexpected to us as fertility doctors. I mean, there was one study that recently reported that early pregnancy bleeding can be as high as 50% of all IVF pregnancies. And these pregnancies, the vast majority go on to do just great, and they're totally fine, and nothing scary happens beyond that point. Or maybe there's another point where there's some bleeding, and then things go just fine, and we forget about those things 2-3 months later. But in the moment, they're extremely scary. And I think that sometimes this is one of those kinds of things where I think some reassurance from an expert can be really helpful, whether that's a nurse or a doctor, to say, hey, listen, I've seen this many times before, and what you're telling me clinically doesn't sound like something I'm scared about. And then B, having objective evidence that everything is fine. Maybe a day or two later, it's time to do an ultrasound, or an earlier ultrasound than what was on the schedule, to have that objective evidence that, hey, here's the pregnancy inside the uterus. Everything looks good. There's a heartbeat. And even then, I don't think it probably takes the anxiety all the way down to zero. I think that always kind of lives there in the background. And it's, again, one of these things where it feels so stressful because it's hard to control it. That's your body is doing what it's doing. But I always also say your body does know what it's doing, and just kind of trust the uterus, because it already knows what to do. It's been kind of created, built that way for a reason. And so it's a hard balance, though, and I think that's a very difficult thing to go through. And it gets back to this idea, just like you were talking about, Dr. Amos. It's like the reality going into any fertility experience, journey, any pregnancy, is that there are going to be probably more than a few moments that are stressful. And I think if you kind of know that going into it, it can actually help a little bit. Help know that, oh, here's another one of those checkpoints that I have to go through that is going to be stressful. Now I have to see, how do I manage this? How do I get to the point where I feel comfortable enough to get myself to the next stage, to get up for work in the morning, to go on with my life, knowing that everything is most likely going to be okay. And I think that's more easily said than done.
Yeah. I know we haven't had a lot of people come on, so like I said, I'm sure this is a very popular topic, but I was going to branch off into some of the questions people have, because
Yes.
like I said, kind of answer it. And stress relievers can also be, as we talked about, not just education, but even the things you do. I've had patients sometimes where they've had recurrent miscarriages. So this is something, again, causes lots of stress. And that's where things like, sometimes I tell people, I go, although I don't think you need to do, let's say, PGT testing or do a whole recurrent pregnancy loss, we probably should start it now because you're stressed about it. And so one of the things that came up here, one of the questions was talk about subcoronary hemorrhages. Yeah, they suck. And they are, I think, probably one of the most stressful things, because you are pretty much sure you lost the pregnancy. And so in case people aren't aware what a subcoronary hemorrhage is, it is when there is a bleed between the uterus and the placenta, and there's a bleed and that blood comes out. So to help relieve people's stress, I think the important thing to first understand is that sometimes the bleeding coming out is a good thing because it means it's not building up, right? If it's building up and building up, it just pushes the pregnancy out. So sometimes bleeding is an outlet for it. So that can be good sometimes. What's really interesting is that the bleeding is not what you think. And it's always important for everyone to understand that when you get pregnant naturally and you ovulate a egg, the sac starts to make progesterone. And that progesterone is what supports the pregnancy. The baby then eventually starts making HCG from the placenta, goes to the corpus luteum and tells it, stick around. I need you for a little while. I'm not making my own progesterone yet. And so if anything ever happens to that baby, then that signal no longer comes to the corpus luteum and it collapses and you lose the progesterone and you get bleeding. And so that's why everyone associates bleeding with something wrong with the baby, because that is actually true. In almost any other situation, that would be true. But it's different when you do IVF. So this is an important thing. If you did, let's say, an IUI and you ovulate naturally, that is still true. But when you do IVF, it's a little bit different. You're taking progesterone. Matter of fact, the baby could theoretically pass away and you wouldn't have a drop of blood. And so now when you have bleeding, this subchorionic hemorrhage, it feels like a miscarriage. It looks like a miscarriage. It could be excessive bleeding. And yet the baby can be there and everything can be fine. And so as the patients here talk about, like, this is one of the most like stressful things it is, but what you need to know is most of the time people actually end up being just fine. And it's scary. But it's definitely not an absolute. I mean, I've seen people where tons of bleeding, and even I thought something was going to be bad. Babies were perfectly fine. And so I don't know how to get rid of the stress, because I don't know any human who that wouldn't be stressful for. I feel like that would be stressful for anyone. But the part is that, again, this is that information, knowing that most of the time things do go well. And most time, things are fine. But it's still scary in that moment. And that's where we talked about, if you're at that moment where you're like, I can't wait till tomorrow, then yeah, you go to the ER, someone show you the heartbeat, you'll feel better. And if you're one of those people who are like, no, I don't want to deal with that, Dr. Mills talked about how horrible that is and they could scare me more, then, like I said, call all on-call doctors if they're available. And if they're not, then, like I said, the next day. Anything to add to that? I know there's a couple more questions here, and I wanted to kind of get to some of these, that from some of these questions people are asking.
Yeah, let's get to that next question. So this is a question about, is there a certain amount of back-to-back chemical pregnancies in which it should be more looked into? Would you say 3 or more, or does it just depend? This is a great question. And, chemical pregnancies are a certain, let's call them, class of miscarriages or kind of unsuccessful pregnancies. And so the way we generally define them is that you have a biomarker like the HCG is telling you that you are pregnant, but you never see anything later on with an ultrasound that shows, yep, there was a pregnancy in the uterus. The society, the American Society for Reproductive Medicine, and our practice is generally like, if you've had 2 miscarriages, to pursue a recurrent pregnancy loss workup. So these would be, this could be chemical pregnancies if they were like, if we knew for sure, yeah, you had a pregnancy there, you had a positive HCG, and 2 of those in a row didn't work. We are at a point where it's very, very fair to pursue a recurrent pregnancy loss workup. Now, here's the other side of that. About half of the time when you do a recurrent pregnancy loss workup after 2 or more miscarriages, you don't find that anything was abnormal. And the most likely reason most of the time is that the pregnancy was just chromosomally or genetically abnormal. It was never going to lead to a viable pregnancy, a chromosomally, genetically viable pregnancy. So I think there's 2 sides to that coin. I think being proactive is the right way to do this, especially talking about this issue that we're talking about, which is anxiety going through fertility. Being proactive has been shown to decrease anxiety levels as we do many of these things. But So the question was basically, at what point should we work this up? At 2 or more.
Yeah. And I'm going to go a little deeper in with chemical pregnancies. It's really important to understand that they're a little bit different than clinical pregnancies. So if you have a clinical pregnancy, it means there's a heartbeat and it stops. A chemical pregnancy means the numbers go up and the numbers go down, but there's nothing seen on ultrasound. And it's important to understand that chemical pregnancies can be lots of things, right? So an ectopic can be a chemical pregnancy. There are other things that are explained. And so I always tell people it depends about the chemical pregnancy, right? So for example, if someone has a very low level chemical pregnancy and then it starts going up and we find out it's an ectopic, that's not a recurrent miscarriage because that's an ectopic. Now it's still concerning you at the ectopic, and that still needs to be addressed. But the reason for it is known. Really, it's when these unknown miscarriages, those are the things that we get worried about. And that's where we do those workups. And unfortunately, as Dr. Salem said, 50% of the time, we don't even find a thing. The good news is with even empiric treatment, chances are things will go fine. But my rule is with these chemicals is I always look at the details. It was interesting. We were at this conference and I kind of brought this up, and I felt like no one even like they I shrugged at it. I was telling them how I've noticed if you watch and you look at the HCG, seeing the rise, seeing how it collapses, tells us a little bit about what happened. And I was surprised no one else looks at that. They were just basically saying, nope, we just check one number and not good. You know, we call it chemical. And I was trying to tell them that I thought I can tell the difference between things. I can see things in the numbers. And so I look at it and ask the question, what's going on in the chemical pregnancy? I am much more concerned about someone whose numbers are going normal, 100, next one, 250, next one, 500, next one, 750, boom, crashes. That to me tells me that number is going up perfectly normal in the beginning and then crash. So I'm thinking something happened that moment, right? Whether it was developmental or something with the embryo, it wasn't something in the beginning. Versus the person who has a chemical pregnancy where I said it's 10, 12, 15, and goes back down. Now I'm thinking an implantation issue. Maybe that's the problem. So unfortunately in medicine, and this is where we talk about that misinformation I was saying, when you read these stories about other people, there's these generalizations that occur when someone says, oh, chemical pregnancy should have this workup, but it's really important to look at those details. And so unfortunately, I can't tell you if there was 3 in a row, what I would do, but what I would tell you is definitely see a fertility doctor, get an opinion about that. And then, like I said, they can go down that right track. So I do want to just tell out Jill on here, who's wrote one of the questions about the subchorionic hemorrhage. I do want to let you know I'm so sorry. She gave some bad news that happened to her with part of that pregnancy, and I'm sorry to hear that, Jill. I think we'll go over one more or 2 questions here. Dr. Sim, did you see the question someone asked about red light therapy? It's funny. I just had someone ask me this today, was asking me about this, saying about red light. I honestly was a little bit confused by it because I know about red light that's external, but they were saying that, how's it help the ovaries? And so I'm just wondering, I'm assuming they're meaning external red light therapy. And I don't know if you have any information. I'll be honest, I don't have any information about it being helpful, but I know it does help with other things.
Right. It's such an interesting thing. I think there's been, interestingly enough, this is a technology from the 1950s and has recently gained a little bit of popularity again. So red light therapy and near infrared light therapy is basically at a very specific wavelength of light that's been studied. There's actually 2 wavelengths of light that have been studied pretty widely in the literature. And the red light is kind of placed on the skin and left for some period of time, 10 to 20 minutes on a daily basis. And the idea there is that, some studies that go, pretty far back showed that it can kind of induce some growth factors and may be helpful for muscular healing, ligament healing. Historically, my understanding is that it's been used the most for post-operative recovery for like soft tissue injuries. It's been used for athletes. Athletes have used it for a long time, and may be of some benefits, kind of like hard to know for sure. And the idea here is, can this help when we're looking at the ovaries? And there's a couple things with the science around this that make it maybe harder to believe. And the biggest one is that the near infrared light, when you penetrate the light through the skin, the maximal depth it will get is about 1.5 inches, I believe. And so, putting it right next to your muscle or ligaments or your knee, where like the distance between the skin and what it's trying to get is really thin, seems to me to make a little bit more sense. I have heard of some people even using it on their thyroid recently. So it's interesting. This is something that's getting some hype again, and there's some interest around, red light therapy. I'm kind of holding out to see some studies that would show, hey, this is actually, demonstrating some benefit. So I would hate to like recommend it without seeing the evidence first.
So you're saying that the thought is then that by putting over by the ovary, the thought is that it's being absorbed going that deep. And I do agree with you. That does seem hard plausibility wise to go that deep. Interesting. That's like I said, I've literally just got asked this question today, and I am just going to go researching, and I still need to look at it more, but I've never heard of it for the ovaries. And I think for patients, this shows you the stress. I think if that's not an example of showing stress, I mean, when you think of all the obstacles we deal with fertility, and now patients we're getting to that point where we're like, does the tea I drink affect it? I'm not doing red light therapy. Is that preventing me from getting pregnant? It's every little thing. And so when we go back to like the point where Jill brought up about the subchorionic hemorrhage, there's a feeling of maybe I caused this. And I think one thing that's really important for patients to know is I can assure you didn't cause it. Subchorionic hemorrhages suck because we really don't know how to prevent them. And I'm not sure about you, Dr. Sam, but I mean, I hate them, and rarely do they ever happen multiple times.
Mm-hmm.
I mean, I can literally count on a few fingers patients who have ever had more than like 3 of them. Mm-hmm. But the thing is, most of the time it's like one and done, and doesn't have it. But Jill, I really appreciate that question that you asked. And like I said, I'm sorry about what you went through. And I think one thing to know is that nothing you did caused it. And I think if there's anything I can tell someone is if you ever have a bad experience like you did, meaning where you had a pregnancy that was lost, it's always important, again, to get more information, not from just fertility doctors, but from like a maternal fetal medicine doctor. And then that way, when that stress part we talked about is by learning from that doctor what those risks are, what's the chance of happening again, what are they going to do different this time, right? They might make a plan that will help at least let you feel more comfortable. And that's what I have my patients do is I have them see a maternal fetal medicine doctor, build a plan so that way you feel comfortable not going in blind, but knowing that you're doing something. So.
Yeah. Absolutely. I think knowledge is definitely key, and knowledge is power here. And I think, depending on the various stages of things, the importance of processing the knowledge too can be really helpful. There's one type of knowledge processing that I think happens with your fertility doctor where I think they can, our job is to really explain things to you and explain it very clearly. Sometimes there might be a better person to help process that knowledge. That might be a therapist, that might be a support group, that might be, and I just want to, again, like continue encouraging people to make sure that, they have a wide group of people that they use for the different parts of their fertility journey. And there are resources out there, and we're happy to also point you to those resources. So you just sometimes just have to ask.
Yeah. I mean, tons of them. Mayo Clinic, they have a ton of stuff out there. A lot of the drug companies, Ferring, they have videos out there. And Dr. Salem was always telling me like how we want to try to improve our website just to have more information for people, because you're right, and the information having it is what reduces stress, and how they process it is a big part, right? And so I agree 100%. It's I like I said, it reminds me of me going through and remembering all the stresses, and it's been a long time. So luckily I don't have to keep dealing with those stresses anymore. But for all those who do, hopefully this was helpful. Hopefully you got from this that you got to have a support system. You got to do the things you like doing. You got to do what works for you. Every person is different. So.
Yep.
Well, perfect. Well, guys, thank you so much. We really appreciate it again. We'll see you guys back in 2 weeks, and we have some creative ways we're gonna get you guys to be live. So we're gonna start having it where maybe you can win stuff for being on, because everybody's a little bit shy. But we'll look forward to talking to you guys again here in a couple weeks. Anything else you want to end on, Dr. Salem?
Just thanks for everybody being here, and we're here to support you as you're going through this journey, and mental health is such an important part of it.
Yeah, absolutely. Again, please send questions, even if it's after the show, then we'll use them for next time. Have a great night.